round of emails to those who couldn't make it. I won't bother you guys, and that way I'll also kind of learn people's names a little bit more. So I'm Mackenzie Cervenka. I'm the director of the Epilepsy Monitoring Unit, and we are doing some training sessions with all of the groups that come into the monitoring unit and interact with patients. So some of this is actually from our nursing lectures that we give as well. But what I realized in talking with the PIs and things is a lot of you go into the rooms, you see patients, you interact with them, and you might not have ever seen a seizure before. You may not know what seizures really are, what they look like, what to do if a patient has one in the epilepsy monitoring unit, and then just some other kind of general housekeeping things. So I wanted to sort of go over that with you. This is very informal. Stop me, ask questions. And I'm going to show you some videos of seizures and then sort of go over some of the safety issues. So this is very basic. Everybody knows what a seizure is. So it's a brief disruption of brain function due to abnormal neuronal firing. And we think of it as kind of an unpredictable, uncontrollable electrical storm of the brain. Epilepsy, on the other hand, is having a tendency to have seizures. So these are patients that have had at least one or more unprovoked seizures, meaning it's not from head trauma, it's not from drug withdrawal, and things like that. We use the EEG, and that's why our patients are in the epilepsy monitoring unit to record electrical activity and to diagnose seizures and figure out exactly where they're coming from. When you hear terms that we use in the epilepsy monitoring unit, like ictal, that is during the seizure. Post-ictal is immediately following the seizure, and interictal means timing between seizures. So this is just how we talk about periods of time when we're talking about the patients and how they're being assessed. So just so you guys know, about 10% of the population will have a seizure sometime in their lifetime. So people don't realize how common this is. And epilepsy is about 2% of the population. So this is a huge number of patients. The risk of recurrence after a single seizure is about 33%, and after a second seizure it's well over 70%, and so that's why we often will start treating patients once they have had a second seizure. There are two major types of seizures. There are focal seizures coming from part of the brain and generalized seizures coming from the whole brain at the same time. All of the patients that you guys see in the epilepsy monitoring unit have focal seizures. We already know this. We would not be doing any kind of intracranial monitoring if we suspect that someone has generalized seizures, because obviously we're not going to take out the whole brain. That would be problematic. So among the focal seizures, there are basically three types. There are simple partial seizures or simple focal seizures. There are complex partial seizures that are also called dyscognitive, and there are tonic-clonic seizures. I'm going to show you guys examples of those so that if you happen to be testing a patient, if you're in the monitoring unit, and all of a sudden the patient does something funny, you can recognize what that might be, and then push the seizure button and let the nursing staff know. So again, we use the EEG to record these and to figure out where the seizures are coming from while we're in the monitoring unit. So the first example I'm going to show you is a little boy. Some of these are older videos. If they have the big head wrap, in that case, it's just to keep the boy from pulling off his electrodes, but sometimes it also means those are the intracranial patients. And so what you'll see in his video, if we can get that to happen, I will break out of this if we can't get that to happen. It was interesting. Alright, I will use the videos themselves. How one might get this on there.
You probably have to break out a slideshow. So
like, okay.